From TechCrunch, Polkadot teams with Intel providing healthcare blockchain solutions. From PwC, Estonia prescribing blockchains for healthcare data security. And from the MIT Technology Review, DeepMind's new blockchain system tracking healthcare records. What on earth does all of that mean? Ladies and gentlemen, as mentioned, my name is Sean. I'm a blockchain researcher, I'm a software trainer, and I'm super excited to be here because in the next short 10 minutes, I'm going to share with you what this new blockchain technology is, some of the properties that it has, and how you can also understand some of these articles the next time you come across them. Because believe me, you'll see a lot more of these in the future. Question. How many of you guys here, prior to coming to the symposium, had heard of blockchains? Wow, I'm surprised. That is good. Now, how many of you guys here had heard of bitcoins? Excellent. You see, I believe that to understand blockchains, it's also important to understand bitcoins, the digital currency. Bitcoin was invented in 2008 by someone or some group called Satoshi Nakamoto. And what happened was that several years later, someone looked under the covers and discovered this thing called blockchains that could be used for other applications other than money. Now, think about this. Imagine someone inventing email, and then several years later, looking under the covers and discovering this underlying infrastructure called the internet. And then creating these weird and wonderful applications, such as the ability to connect with friends and family, Facebook, the ability to tell the world what you thought of that movie you saw last night in less than 140 characters, Twitter, or taking that spare car you've got out of the garage and making some extra money, Uber. You see, blockchains is similar. There's this underlying infrastructure where lots of people are creating these weird and wonderful applications, many of which have yet to be invented. And that's one of the most exciting parts of this particular technology. So, I've talked a little bit about where blockchains kind of came from, but what is it exactly? Well, much like the internet, there's not one single correct definition. So try this. It's a decentralized network that can achieve consensus without the need for any third-party controlling authority. Okay? How about this? It's a distributed system for recording and storing transactions. How about a digital ledger designed to track any type of transaction in a secure and transparent fashion? Now, you might be thinking, once again, what on earth does all of that mean? I might as well be speaking Chinese. Well, I wish I could, but that's another story. How about this? It's a large global database where information is stored all over the world. It just doesn't sound as cool, right? However, the properties that it has are super cool. First of all, it's immutable. What this means is that you cannot rewrite history. You cannot alter those blood test results. It's decentralized, so instead of trying to hack into one DHB's database, I've got to hack into 100 around the world. It's secure. Because it's decentralized, there's no single point of attack. And finally, it uses cryptography and mathematics to secure the data under the covers. Now, I was at the 3rd annual New Zealand Blockchain Conference held in Auckland a couple of weeks ago. And it was an amazing conference, but there was a speaker here that I just came to know, Professor John Halamka. How many of you guys have heard of Professor Halamka? A couple. He gave an amazing talk on his research around the potential for blockchains to transform electronic health records. EHR, as they put it. So what he talked about was it's actually quite a manual process to try and reconcile medical data across the likes of the clinics, the hospitals, the laboratories, the pharmacies, even the health insurance companies. So he came up with a novel solution to record all of this in a distributed record management system, utilizing, of course, the blockchain. There's a link here to this particular article, which I'd highly recommend reading, and I'm sure it'll be made available to you. And he was beamed through via Skype. I can assure you he's actually on the screen here. And that's because he's actually due in the country in a couple of weeks. He's an independent board director of Orion Health, and I'm sure you'll be hearing a lot of wonderful topics from him, so keep an eye out for his topic and talks. Okay, so now with a bit of this information, let's go back to some of these articles to see if we can understand them in a bit more. From TechCrunch, Polkadot teams with Intel to provide healthcare solution on the blockchain. What these guys are doing is around identity management. What this means is they want to be able to verify that the third parties involved are actually who they say they are. From PwC, talking about Estonia. Now, Estonia is a pretty amazing country. Not only can you be an e-resident, their entire stock exchange is on the blockchain. And there was a lady talking about this in Auckland. And she actually came down and talked to the people from the New Zealand Stock Exchange as well. What these guys are talking about are bringing together the doctors, the surgeons, the pharmacies, etc., all the medical professions, so that there's a single view of patient data. And from MIT, Google's DeepMind, talking and using blockchain systems for this healthcare record system, kind of like what Professor Halamka was talking about. What these guys want to do is log every single piece of patient data so that there's this indelible audit trail. Now what happens is that with this data, the healthcare providers and even the patients can understand who's accessing the data and for what purpose. The opportunities are tremendous. The opportunities to create this ubiquitous, secure network infrastructure, to verify identity, and also to authenticate all the participants involved. And also to present this consistent representation of patient information. So in summary, a blockchain is a global, distributed, secure, immutable database where lots of weird and wonderful applications, many of which have yet to be invented, can be built. And the key part is in this new decentralized paradigm. Now, ladies and gentlemen, this is just a brief introduction into what blockchain technology is. I haven't touched on the likes of consensus algorithms, such as proof of work, proof of stake, who you may have heard of, and one that I thought of just now, proof of health. That's an interesting one. I haven't talked about the difference between a public blockchain and a private blockchain. I haven't talked about tokens, cryptocurrencies. There could be a health token linked to the insurance as well. It's a big area, and I may be an evangelist, but I'm not an extreme evangelist. I don't think blockchain is going to solve world hunger. But I do believe that this technology is big enough and it's important enough that for all of us here in the room to not turn a blind eye and keep one ear to the ground. Thank you.